the liver started to talk to me. I had my eyes wide open. It was as if my eyes became like x-rays, and they went through the blanket, through her gown, through her skin, it was around her abdomen, and then deep into her liver. And the liver started to talk to me. It started to tell me the main reason why she was sick, because there's an energetic, emotional reason for all illnesses. So I'm at the bedside and I'm listening. It's like I'm having an auditory and clairvoyant moment with her liver, because I can see the cellular activity and I can see this backup in the bile duct, and I can see disease process heading towards your pancreas. So by the third time that this sort of thing happened, and then it felt like every day I'm just having psychic phenomena, and I was a charge nurse, so I called the code, and I really thought I was going to get suspended. I thought she was going to order a Psych Eval.
Still have questions? Well, join me live for Wake Up Wednesdays at 5 p.m. Pacific, 6 p.m. Mountain, 7 p.m. Central, and 8 p.m. Eastern. I'll answer your questions, and you might see a familiar face. Together, we're waking up the collective. Thank you for watching. My guest today is Marie Manuchehri, who started out as an oncology nurse, and she actually heard her patients' organs speak to her. And then the dead started to come in, and they were answering questions like, who are we? Why are we here? And where is humanity going? And how in the world do we connect to the other side? So Marie, welcome. Thank you so much for joining us today.
Thank you, Lori. It's a pleasure to be here. Thank you for having me.
This is going to be such a good conversation. I've been excited about this all day today, and I know exactly where I want to start. It's a little bit of a longer question, but I think it's really important. First of all, your story has gone to millions of people right now, and I think the reason is because people are hungry for the truth. And they want to know questions like, are we alone? Do our passed away loved ones still love us? And is humanity going through an awakening right now, or are we actually falling apart? And you have now spent decades communicating with the other side. And I think that something right now is happening in the earth. And are we going through a collective dark night of the soul right now?
I think that's a great way to describe it, that it could be a collective dark night of the soul. I know that we've been asked to evolve. And, we're part, the earth, even though it's one of the lowest vibrational realities in all of the universes, we are part of the whole, the collective. And so the universes wants to do a major growth of consciousness. And since we're a part of it, we also are required to have a boost in consciousness as well. And so what's happening collectively is that compassion is a big part of consciousness. And we have a lot of people on earth who aren't as compassionate, perhaps, to allow us to move into expanded knowingness and awareness and into the multisensory world. And so now we have this great opportunity for individuals who would like to expand their energy and be part of the collective, because we don't have to have everyone on the planet move at the same time. We just need a tipping point, which could be 1 million people, right? Or 2 million. I don't know what the actual number is for the entire world to have a growth in consciousness, but we do need a percentage of individuals to have an authentic shift in their awareness about compassion. Younger souls are here to learn compassion for others. And on Earth, we're about 50-50 in terms of 50% of the population are younger souls, and there's varied degrees of soul growth, within that population. And then 50% of the population are older souls, also varying degrees of, aspects of older growth consciousness as well. And so we're learning to expand through consciousness. Older souls are learning self-compassion, because that's just as critical, as having compassion for others. You could have enormous compassion for other people, but if you don't have compassion for yourself, you're also missing an incredible boat, an incredible opportunity for conscious awareness. So older soul types who are probably very alarmed about Earth right now and the things that are happening, all these things are really not for them to grow their consciousness. It's a time for them to go inward and not to be as bothered by the world activities. Of course, do all the things, vote appropriately or donate resources or whatever it is that you want to do that brings you great joy, but not to be so affected by what's happening on the earth realm, because it can lead to high cortisol levels for them, a lot of stress and anxiety, health issues, and to really just take care of themselves, to feel a little selfish. That could go a long way of us reaching that tipping point so that all of the universes can have a jump in awareness.
Wow, that's fantastic. So, what do you think is collapsing right now that actually needs to collapse right now?
The patriarch. So the masculine frequency that has been dominating the earth realm, which is not the fault of only the masculine. My father pointed, my family is very spiritual. It was kind of weird that I became a nurse. Everybody was against it in my family, me going to nursing school. They go to naturopathic school. Why are you going to nursing school? But I felt this incredible pull and joy. And I loved every minute of nursing school. I miss the hospital still every day. And I became psychic on the hospital floor. So that's where I was supposed to be. But my father said something really interesting to me when we were talking about masculine, he's now passed, and feminine energy. And he said, well, even women wanted people to take care of them. So like we were talking basically about the Civil War at the time. And, we were, in my mind, I was blaming men, for whatever reason. And goes, well, women didn't want to cook their own food and wash their own clothes, so he said, when you think of the dominance of the masculine energy, both feminine and masculine energies have been allowing this dominance to occur. And you can't live for enormous lengths of time having only one form of energy maintaining an earth realm or some other similar reality. You have to have it in balance. You have to have masculine and feminine energy in balance so that we get the best of both of these energies and allow for unification and deeper understanding and projection into the future, because that's what feminine energy does. It looks at the future. Masculine energy looks at the moment. What do we do in this moment to make things better? And feminine energy looks at generations. What do we need to do for generations to make things look better?
Wow. Well, I think I've heard you say that the next 5 years for humanity are going to be critical.
I think it's already happened, honestly, Lori. I think that it's going to feel critical to a lot of people, but I think the shift in many ways has already occurred. It reminds me of the late 90s. That's when a bunch of people woke up. A lot of professional, intuitive, and psychics today woke up in the mid to late 90s. I was one of them, where I started having unprovoked psychic experiences. I wasn't meditating. I wasn't doing anything significant. I didn't even desire I never desired to be an intuitive. I thought they were fantastic. I read a lot of books about it, but it was nothing that was on my list. I never even considered it. So I think we're in the same place right now, but I think it's going to affect more people than it did in the 90s. I think I think we're going to see a lot of people waking up and having phenomenal multisensory experiences, which as an individual, when you have multisensory experiences, it frees you in ways that you could never imagine. You don't feel alone in the world, because we're not anyway. You feel more love and compassion for yourself and all of the human realm and all the realms that you can't see or don't know very much about. It's just a love fest, really. And you feel very supported. You feel cherished. Even if it's not all day, it's definitely moments of the day that take your breath away and remind you of your magnificence, because every single soul is magnificent. Every soul is a part of the divine. Every being is a part of God or the universe, or whatever words people like. I like the G word personally. And
I
and
like the
so
S word.
you like that? So you like source?
I
Yeah,
do. I
yeah.
really do. I really do.
Yeah. And so everybody has the word that works for them, right? And that's what's important. And I've never studied religion. I've never even read a Bible, but because my family was not religious at all. And when they left, both my parents were Roman Catholic, and we were all baptized, but they left the church when I was 5, and I'm the oldest of all the siblings. So, and then my parents became hippies. So it was, yeah.
I love it. Oh my gosh, this is great. Well, because you started talking about how you became awakened in the 90s, I know that you're an oncology nurse and you had patients whose organs began to speak to you. Will you share that journey of waking up and being aware that we were super connected to what was going on the other side?
Yeah, that's how it first happened for me. Um, is I was at a bedside of a patient. I think I was changing, it was a woman, her IV, and I was probably hanging a new medicine. I don't think I was hanging a chemotherapy drug at the moment, but this person was receiving chemo. I worked inpatient. So our patients were very ill and stayed months with us most times. And she was relaxed. She was kind of like half asleep. We weren't talking. And all of a sudden, I had my eyes wide open. It was as if my eyes became like x-rays, and they went through the blanket, through her gown, through her skin. It was around her abdomen, and then deep into her liver. And of course, I've had anatomy and physiology, so I knew I was in the liver. And the liver started to talk to me. It started to tell me the main reason why she was sick. Because there's an energetic, emotional reason for all illnesses, for everything, for divorces, for financial issues, any problem that anyone has. It first has to start energetically. It happens way outside of the human form, way outside of the aura, whatever the situation is. And it has to do with emotions. And a lot of humans have repressed emotions. They don't allow themselves to feel their feelings. They don't allow themselves to name their feelings. A lot of people don't even know, even highly empathic, conscious aware people know more about other people's feelings than their own feelings, right? Well, they do, because I know I'm an empath, and that's the one person I struggle with knowing what I need and what I want and what I feel is myself. I could look at just about anyone and know instantly what's in their best interest, and all of those things. So I'm at the bedside and I'm listening. It's like I'm having an auditory and clairvoyant moment with her liver, because I can see it, and I can see the cellular activity, and I can see this backup in the bile duct, and I can see disease process heading towards her pancreas. And it told me that she had an enormous amount of repressed anger. And if she could just throw a few temper tantrums and really just let herself get mad, they could slow down the disease process. And then, of course, we were giving her very strong chemicals, and the liver's now trying to detoxify the chemicals that we were giving her. And I didn't have a conversation with her. It took me a
Oh, it's good. I
while.
was hoping it was like, what in the world do you say to somebody? Like, you must be thinking, I'm going crazy. I just heard this person's liver tell me all of this, and there's got to be a part of you that wants so badly to say something, but then you're terrified that what if you're wrong?
Right. Well, there was a little bit of that when I started to speak, So I trained myself in the hospital. I laid my hands on hundreds of patients. I was actually encouraged by my nurse supervisor. So by the third time that this sort of thing happened, and then it felt like every day I'm just having psychic phenomena. And I was a charge nurse. So I called the code, and I had a personal rule. Nobody coded under my watch. So that means I moved patients to critical care, with the blessing of their physician, of course, or we changed their code status. So I was kind of vigilant about it. And so I went to my nurse supervisor after like the third experience occurred. And I really didn't have any idea to tell the patients, because I was actually loving the experience. And luckily, I was raised not to be fearful of intuition. So I wasn't scared about that. But I was afraid I wouldn't go get the crash cart if somebody were to code, or I wouldn't pay attention that someone's about to code, right? So I went to her to tell her, and my guides, because I could see spirit guides by that time. I was having experiences, and my guides were telling me I had to talk to the nurse supervisor. And I really thought I was going to get suspended. I thought she was going to order a psych eval. And our in-house psychologist was Dr. Sandman, which is kind of hysterical but scary at the same time. So,
Especially since that Metallica song was out in the 90s.
right, I know, right? Like I was born in the 60s, so. So she actually said to me, I think you're seeing energy and you need to start laying your hands on our patients. And so that's why my guides wanted me to tell her, because she encouraged me to lay hands on people. And I trained myself. I looked at all kinds of programs because I thought, because I didn't even know what a chakra was. I'd never studied energy medicine. I knew nothing about it. That my guides were clear. They go, you already have a hospital full of patients. Go lay your hands on them. The universe will teach you. We would love to be your teacher. And so I would go into patients' rooms I wasn't assigned to, and I would lay hands on them and read their energy and hear what their organs were telling me or their past lives. I had all kinds of incredible and beautiful experiences. And then I would go out and read their chart, and I would formulate what I experienced intuitively with their diagnoses and things of that
Brilliant.
nature.
This is
The universe
brilliant.
is
So you're like
brilliant.
in a crash course for yourself,
Right.
testing yourself
Yeah.
with the answers on a chart that you can actually
Read.
evidentially
Yeah.
see. And
Right.
how often were you right?
I was Well, I was learning, so I don't think of myself as right or wrong. I was often like, oh, I'm in the ovaries. And then I go, oh, they have ovarian cancer, So,
Oh my
so I was,
God.
my accuracy is about 87%.
That's
Um,
incredible, Marie.
that's what the universe has told me. I started to practice about a year and a half after that. Physicians would sometimes, three different doctors ordered me to lay hands on their patients. And
What?
because their patients would feel better, their pain would go away, they would sleep through the
So
night.
you're modulating pain with what you're doing.
Right. Yeah.
At
And
what point do you start saying things to the patients
it was
now?
this one time, so I'd probably been doing it for 6 months or so before and I would be nervous. I would shut the door. And of course, everyone on the floor knew, because I would always go up to that patient's nurse and say, would you mind if I went and laid hands on your patient? I just wanted them to know. And they would say, sure, that's fine. And so there was this one patient. His daughter was a respiratory therapist in the hospital, and he had all this weird neurological stuff. And by then we were onc and medical. And so he was a medical patient, and they were trying to diagnose him. And his daughter asked me if I would lay hands on him. So I went into his room, and his wife was present. I laid hands on him, and I was immediately taken into like the 1920s, because this gentleman was older. And I saw him on a bike. I saw him as a little kid on a bike. He was maybe 6 or 7. And I heard there was a major trauma in his life and a tragedy. And that's why he was having neurological issues. Because the seventh chakra, which connects to the divine and helps us to understand life circumstances, also affects all the neurological systems. So I started speaking out loud that day, because my guides had been yelling at me very nicely, but say something, speak, say something, right? So, and he said he didn't know what I was talking about, but his wife, who was sitting in the corner of the room, was crying. And she said when he was that age, his father had a massive stroke and was paralyzed and couldn't talk. And he became the man of the house at a very young age. And interesting enough, for 6 months after I gave that one and only session with him, his pain went away. He didn't require medications, because he was on a lot of medications and they were trying to figure it out. He didn't want, or I don't know if he didn't want to see me or whatnot, but I never saw him again. But I heard through his daughter that his pain came back after 6 months, but it was not as severe. But nevertheless, I thought, ooh, if we could have worked together longer, maybe the conversations would help his consciousness, his unconsciousness too, so he could eradicate some of the trauma in his body.
Marie, do you know what I love about that story? Several things. Number one, that his daughter asked you to go in. That's number one. But number two, the timing of when you went in wasn't when he was just there by himself, because you wouldn't
No,
have been validated at all.
right.
They had you go in when his wife was there, and then they're yelling at you to the point where you finally actually speak, where somebody else outside of the patient could help mediate a response to reduce pain. Like, how incredible the timing of all of that. Like,
Yeah.
that couldn't have been lost on you.
No, I also think that working in conventional medicine, because I was raised in holistic, my mother would never take us to MDs unless someone broke a bone or needed a vaccine, and we had to go to school and they wouldn't let us, or something like that. And so I knew a lot about holistic medicine and understood it fairly well. but I see so many people who've been in the conventional medicine realm of life, and because I understand it, I'm comfortable with it. I love it. We need both still because of the consciousness on Earth, and so I thought that was like so smart of the universe to have
I
me
know. There must be
attracted.
a divine intelligence in there somewhere.
Yeah, I mean, I'm forever grateful because I'm able to help people who are kind of stuck, and haven't been able to get better, or I'm able to validate their own perceptions that can lead to their health and well-being that go against what their physician is expressing. Of course, people can make their own decisions, and I support whatever choice anybody makes. But yeah, I'm extremely grateful. It's been a really fun, wild, interesting ride of a career that just continues to grow and
You
expand
are
in
not
different
kidding.
ways.
Okay, I got to have more. Please, can you share one more of the story like this where you laid hands on somebody and had an incredible experience? Maybe
Well, it's
something you haven't shared before.
every single time I lay hands on someone, it's an incredible experience for me. The other one that is also a hospital story, it was the first time I talked to a dead person knowingly. And at that point, until I laid hands on people, I wasn't even sure if reincarnation was real. I wasn't against it, but I just hadn't had my own kind of experience about it. I was open to it. And a woman who was floating against the ceiling in the hospital yelled at me all day long to visit her son, who was in one of the hospital rooms. And I didn't know which one. And it was a really big unit. And I was the charge nurse that day. So you know what that's like because you've been in hospital floors. And you have 3 or 4 pagers on when you're a charge nurse and you're kind of running around all day long. You stay in shape for sure, right? So I didn't know what room he was in, and I was really busy. I was also getting a divorce. I'd started a small practice at home, and I had 3 kids, so I had a lot going on. And finally, at the end of the day, she didn't yell at me, but I could see her floating. And all of a sudden, one of the hospital patient doors started to glow. And I'm like, oh, he's in that room. And I didn't know why she wanted me to see him. I had no idea. I went to his nurse, as I always did, and said, hey, because by then everybody knew what I was doing, even what did we call them? Supervisors on other floors had called me in on several different occasions and paid me time and a half to go lay hands on hospital staff that was hospitalized. And so I was, yeah, very supported at this one particular hospital. The CFO of the hospital, or maybe he was the CEO, we had like Wayne Dyer and Gary Zukav come
Oh
speak.
my gosh, that's
Yeah,
incredible.
they would rent another facility, a Maidenbauer Center, and it was open to the public, but hospital staff got to attend for free or at discount. So it was really quite remarkable. So anyway, this woman whose face had kind of contorted out of this blue silk fabric, and I at the time she was probably younger, but at the time I was thinking, oh, she's probably in her 80s. And I knocked on his door and introduced myself. And I said, has your mother passed? Because I didn't know. This is my very first medium experience. And he said, yes. And I said, well, I think she's been yelling at me all day long. Would you consider her, a strong woman or pushy? And there was a young woman sitting next to him, which I thought was his wife, but he introduced me to his sister. And they both burst out laughing and said, yes, our mother was very strong and very pushy. And I said, well, she wants me to lay hands on you. I don't know why, but would you allow me to? And he said yes. So I, rubbed my hands together to cleanse out these medium-sized chakras and laid them on the blanket, closed my eyes, and I could hear her. And she said to me that he had a terminal illness, which he did. He had pancreatic cancer. And he thought he wasn't going to go home. He thought he was going to die during that hospitalization. And she wanted him to know that he still had time and he was going home. And that when he finally would leave his body, she would be the first person he would see. And so he was crying the whole time. His sister didn't know that he was that sad about not being able to go home again, like he wasn't ready. And his mother was letting him know. He looked great to me. I would not have known that he had pancreatic cancer. He looked fabulous. And so that was my first experience. Yeah.
Did he get to go home?
He went home. Yeah. 2 days later, he went home. Yeah.
Wow. Okay. I would love for you to share this because I've never heard anybody say anything like this before. Will you explain to everybody what hospitals really are?
Oh, yeah. Hospitals are beautiful stations of transformation. You know, they are phenomenal aspects of bright light. It's kind of like certain churches empty, you know, like when there's not a priest in a church, you know, if we're looking at priests or the Catholicism, they are just magnificent, you know, avenues and landscapes of supreme bright light. Well, hospitals full of people are the same thing. And we have so many souls coming in. We have babies being born. So those are souls coming to earth. They're reincarnating to the physical realm. That means all their guides are present, archangels are present. Then we have souls leaving, you know, and that means guides are present with them and angels and departed loved ones. It's a very busy highway. And then just going into the hospital is it a transformation for some people, people who survive or get better. They make resolutions. Their families sometimes bond and have better, you know, experiences because they had a scare, or oh my gosh, I didn't know my grandpa was that sick. And it's a wonderful melting pot. It's a beacon of light for transformation.
Wow. So is it because of all the souls that are coming in and going out at the same
Yes. And
time?
angels. I mean, it's just drenched with God when you think about it.
Since you mentioned angels, I know that this has been a fascination for a lot of people and you've had a lot of experience with them. Will you explain what you understand about angels and how they help us?
Sure. So there are different species than being in physical form. There are different species than spirit guides. So angels hold space for humanity primarily when something challenging is happening. So, like when an airplane is going down, there could be hundreds of thousands of angels around that airplane. 9/11, there were millions of angels.
You just gave me goosebumps all over my whole body when
Millions,
you said that.
millions. And that's why when people have near death experiences, they don't describe fear or chaos or because they're being held, even if their body is having a reaction. I'll tell an interesting story in just a moment. When the body's having a reaction, it doesn't mean the person is feeling it. They may not be feeling it, but the body is going to have a reaction because something happened to it, right? So angels hold space so that beings can leave their physical form or find their child lost in a grocery store or avoid a car accident because it's not always someone's time to leave. And sometimes we get in precarious circumstances where we could jump out of our body and that's maybe not in our best interest. And so angels are here to support humans during challenging times and bring whatever's in the highest good for that individual into that experience in that moment. That's their job.
I love that. I've had several people who have had near the death experiences in life reviews were shown in their life reviews the times that angels intervened and helped them during their lifetime. So
Yes.
definitely evidential information. You said you were going to share something special.
Yeah. So when before I worked in a hospital, I worked in a long-term care facility, and it was a huge place where there was lots of condos where people lived in their condos, and we were like an upper scale facility where we could do acute care work as well. So we didn't know all of our patients. They were lived in these facilities or in these condos. And so this one woman had had a major stroke and she went out to the hospital and she came back to us on hospice. So she was going to leave her body. And of course, I'd never met her, and she was one of my patients. And she would moan almost all the time, even though we had her on a morphine drip and her vital signs were normal. Her son had flown in from New York and was staying in her condo. And of course, he was very upset that she was moaning. I worked evenings, so I never met him. And the staff were trying to do everything we could to tell him we think she was okay. And we can't give her any more morphine because we would have killed her, even though she was on hospice. It's just this whole complicated scenario with, you know. So one night I'm passing out pills because I worked evening and I looked in her room and I thought maybe she had passed. And so I went to her bed because I had another rule. Nobody dies alone on my watch, right? So you know, kind of quickly move into the room and I sit on the side of her bed. I put the stethoscope, you know, prongs into my ears and I lean over to auscultate her lungs and she woke up. And she sat up straight in bed, hugged me, kissed me, told me she loved me, and that she's having a wonderful time on the other side. She's with her husband, her parents, her friends. And then she kissed me again and went back to sleep. So I called her son because I did try to, I'm like, tried to wake her up a little bit, but she wasn't waking up. So I called her son and told him what had happened and charted the whole thing. And I came back the next day, and the charge nurse of day shift asked me if I had been stoned. I said, no, I haven't smoked marijuana since high school or junior high, probably. And she did pass away a couple days later. So I think what's important about that story is that, again, the body is going to have a reaction. And I think this is important when people sit with people who are leaving their bodies and they're unconscious or they're semi-conscious. And we think because they're shaking in bed or they're moaning or they're calling out that they are in pain, but they may not be in pain. They could very well be held in the bosom of all their loved ones and in the divine. In fact, most of their energy is probably outside of their body, and they're trying to shake out the rest so that they can cross over.
Whoa, I'm so glad you shared that. What a beautiful story, because I know that a lot of people who come to a channel like this are looking for comfort because they're either going to lose a loved one, they have lost a loved one. And I've also sometimes heard mediums say this, and I would love to hear what you think about this. They will say that sometimes if your loved ones are not connecting with you, it's because they're too busy on the other side.
They're
I
very
just can't
busy.
reconcile. I'm sure that they're busy, but are they too busy to connect with us? What do you think?
Well, first of all, I think a lot of humans miss the connection. So a lot of humans
Yeah.
aren't present. They're scared. I mean, one of my favorite things was to sit at the bedside of someone who was leaving their body because it's such a profound moment. But then I'm more aware of the synchronicities and the kind of subliminal kind of information that's occurring. So a lot of times I think there is information occurring, but the family members are so upset and so distraught that they can't hear it, see it, or feel it. But it's like a baby shower on the other side when someone goes home. It's very busy. So it's about 4 years before we leave our body. Everybody on the other side is notified that we're going to be returning home, approximately 4 years, even though time does not exist. This is what
4 years Earth time?
Earth time.
Okay, not the
So,
same on the other side, probably
right.
a week or 2 days.
Well, right, right. Well, they're notified. You're right. It could be 2 days because time goes by so much faster on the other side. And so they're notified no matter what dimension they're living in, right? Because souls can live in all kinds of unique vibrational realities that we know nothing about, at least not when we're in physical form. And so they start to gather, right? And even though when you leave your body, you don't eat because you don't have a stomach, you don't even have a brain because you only need a brain in a third dimensional reality. But they have food there for you because you can smell it. You can pretend that you're eating it. They have anything that's going to make you feel comfortable and safe and excited. And you're going to recognize people that you've known from previous lifetimes, like quickly. So it's a big to do, and they are very, very busy. And humans who don't do any inner work on earth, at least consciously, because you can do inner work subconsciously, but people who don't do any work consciously, they could be doing a lot of inner work as they're in bed, getting ready to transition from physical to non-physical, because they could be having a lot of awarenesses that they didn't have before about this particular lifetime, that they're kind of, sewing up some misconstrued perceptions, if you will.
Wow. So one of the things that I've heard a couple of times in near death experiences is that they will not only see all of their passed away loved ones and people who were in other lives with them, but they will see people who are still on earth. And
Yes.
I think that that's because we do not completely incarnate our higher selves into this
No,
experience. Will you
we
speak
don't.
to that a little bit and
Well,
explain
we
that to people?
can't, like your soul is so vast. From a physical perception, it's as big as a house, like a 3,000 square foot house. And it looks like a fleshy red heart muscle to me, something similar. That's what the soul looks like. And it's very aware and conscious above what humanity experiences. So we can't bring all of our awareness with us to earth because we would go crazy. number one, because this is a lower conscious reality. And second, you don't need it all. You bring the parts that you need to heal what you want to heal, to experience what you want to experience. Like you brought the part of your consciousness that loves to be outdoors and to hike. The little bit that we talked prior to going live on the podcast, you love the outdoors, you love adventure. So you brought that part of you. You don't have to bring everything to the earth realm because the earth realm is limited. It's a third dimensional reality. But you bring the things that you can't do as readily because you don't have a physical body. You can't climb mountains the way you do in the non-physical realm. It's a very different experience. Even sex is very different. In the it's considered more pleasurable to have healthy, loving sex in the physical than in the non-physical.
Wait a minute. It's more pleasurable here than
Yes,
there.
right.
We're going to
Healthy,
miss it.
wonderful sex. Exactly. That's what I've been told.
Maybe this is why we keep coming back so much.
Maybe. I think you're onto something there. Yeah.
I want the chocolate and the sex and the Diet Mountain Dew for me.
Mine's Diet Dr. Pepper.
Oh,
And
funny.
both of those things are so unhealthy,
And you know what? It's
but
I say two things. Number one, I know that I hike enough to metabolize anything out, but I was actually shown on one of my experiences on the other side that it didn't matter what
right.
I did because that's not where I'm gonna go. I'm not gonna die from
Right.
my Mountain Dew poisoning. It's not gonna happen.
and
It's gonna be
it
something
brings
else.
and it brings you pleasure. So anything
It
that brings this
does.
authentic pleasure raises your vibration, and that's why you can detoxify from it. That's why some people can be 90 and smoke, because the tar and nicotine
Oh,
isn't
talk
going
to
to
this
hurt
is
them.
okay. These are the okay. I call these gold nuggets for my audience. You're
Mhm.
holding this wisdom, and we just uncovered one. Tell people a little bit more because I think sometimes people feel guilty for these things, and we are here to experience.
Right.
It is one of the number one reasons that we are here is to experience. And then people are like, well, I'm going to not have this and I'm going to not. And we start limiting all these things.
Right.
And all we do is bring ourselves down instead of bringing ourselves up. So will you speak to this?
Yeah. So the answer is pure bliss and joy. If something brings you pure bliss and joy, I just had a Diet Dr. Pepper on Tuesday. I was at a preschool graduation. There was a cooler. And I mean, my whole being just went, Diet, because I don't even shop in grocery stores that sell Diet Coke, right? So it's like, oh my gosh, Diet Dr. Pepper, yay. And my whole soul loved it. So someone who authentically loves tar and nicotine and the 200 chemicals that are present in cigarettes, right? They're going to metabolize that. Like you and I, we don't even like the smell. So
No.
it doesn't bring us joy.
Right.
So we then lower our vibration. So we're more at risk for things associated with, the byproducts of those poisons. So it's okay to indulge in things that bring you joy, but you have to know yourself and to know what the feeling of joy feels like in your body in the absence of joy, right? So that's a
Oh,
critical and important part of evolution because that even leads to careers, friendships, traveling, where to live in the world. you know like those grocery stores that don't sell Diet Coke do make me the most happiest. They are the ones that, I mean, it's very expensive when I leave that grocery store, but I don't even care because I'm in bliss the whole time that I'm skipping down the aisles, looking at high priced organic packaged food. It makes me happy,
I
right?
love it. You know, what I'm hearing from you is we need to lighten up. And again, I think this goes back a little bit to the self-love. So you had these
Ah.
absolutely incredible experiences when you were a little kid. Will you please share some of this? Because this ties back into the self-love part. And I think this is so important for
I'm not sure
everybody.
which ones you're talking about, like
The
experiences.
Archangel Michael ones.
Oh, that those happened later in life for me.
Oh, wait a minute. I thought they
Yeah.
were when you were little.
Mm-mm. I had some experiences. I can remember like laying on grass and just being out. I love that you could be alone as a kid when I was a kid and you didn't have a phone or a pager, like our kids couldn't go anywhere, like they had
You know,
devices on them.
come home when the street lights come on. That
Yeah,
was our
right. You,
instruction,
you would eat
right?
a bologna sandwich at some other kid's mom's
With some
house.
Kool-Aid, wash it down with some Kool-Aid.
Yeah, right. So I did have those kind of experiences, but a lot of the ones that I was most conscious of happened prior to me even having the awakening. Um, Yeah. So I had an experience with Archangel Michael. I was married and I heard that the family office room, which was my ex-husband, then husband, his workout room. So there was all this gym equipment in there. I heard that was supposed to be my healing room and he needed to move everything in the garage. And I was a very passive, submissive wife. I was 20 when I got married and he's the opposite. And so I didn't even know there's no way he's going to move his furniture into the garage. There's no way. And I was told I even needed to, by Archangel Michael, to paint the ceiling with flowers. So I bought all these stencils and I was going to paint it with flowers. So I was kind of like, I was testing all the time. Like I said, is this really Archangel Michael? And they said, well, you'll see coins if it's Archangel Michael. And every room I would walk into in the house, there'd be a penny on a windowsill or a dime on the carpet when I would vacuum. So I would get these validations because at first I don't question anything now, but at first I questioned it. So I thought, well, I'm going to ask him. He's never going to move his equipment into the garage. He immediately moved all of his equipment into the garage. And then a few weeks later, as I'm trying to convince him, even though I had a job, he had control over all the money, and all of that. I allowed it, that I allowed this to happen. It's not all his fault. I had a huge part of that responsibility, which was something I learned in that relationship. But I was trying to convince him to buy this expensive stationary massage table because even though I didn't know exactly what I was going to do, and then all the equipment that went with it. And he was being very kind, but it was clear he wasn't going to purchase it. And one of his friends came over spontaneously, who also was a little tight with his partner's resource use. But he talked my then husband into buying everything right then and there. Let me use the debit card because we didn't have credit cards. He was very, careful about all of those things. And 5 months later, his friend was diagnosed with a benign brain tumor that was in a really weird location that he would have lost his sight. But of course, he had a wonderful neurologist. But I worked on a neurological surgeon. I worked on him for weeks before he had the surgery. And then because I was a nurse, I was able to go into the ICU immediately post-operatively and work on him. And I think he had a tiny sliver of something that's very hard to recognize in terms of some eyesight loss. It was a tiny sliver, like he'd have to look hard to identify it. And so I think that was, again, Archangel Michael helping to prep the whole scene and help me to feel convinced that what I was doing was helpful and beneficial and that there was an alignment that I was following.
And your husband to be convinced, like
I
how would
know.
he not be convinced by his
In
friend going through this?
in
How crazy.
seconds, but so we all have guides, right? We all have guides and our guides talk to each other. So I'm sure that my guides were talking to his guides. Okay, you're going to move all the weight equipment into the garage when Marie asks you. And then his friends' guides were talking to, again, my former husband's guides. Okay, I'm going to come over and you're going to purchase all of that massage equipment because I'm going to need it. Or, the friend's going to need it. Yeah.
Oh my gosh, it takes a village.
It really does. It takes an absolute village. That's why sometimes people will take a class or listen to your podcast because their friends' guides have been talking to them, for weeks on end, trying to convince them because they want to have a shift in their perception. They want to start to experience the multisensory world. Or maybe a family member is going to have a health issue and they're going to need support that goes beyond the physical world. And so these conversations are happening all the time within the fourth dimension. So within the astral plane, which is where the guides kind of hang out and help orchestra and guide humans, because that's their job, is to guide us. Yeah.
Well, why is self-love
Oh,
not just emotionally healing, but how is it also an emotional technology for raising consciousness?
that's a really great question. I'm first going to talk about it from a physical perspective and then ask your very cool, interesting, or answer your very cool, interesting question. So the third chakra governs the immune system, including the liver, pancreas, gallbladder, spleen, stomach, small intestine. So it also governs the hormones in the body and the lymph nodes and the lymphatic fluid. So it's a huge vortex. And each one of the in terms of its responsibility. Each one of the major chakras have an emotional component. And that's really what we need to do, is help people align to the authentic emotional component for that chakra to heal their body. And the third chakra is self-love. So the premise is, I believe, that the more you love yourself, the healthier you become, the stronger your immune system is, the more you're guided if you need something out in the world to help your body to heal. Like, I was very much against HRT. Like, I never really had my hormones checked until my late 50s. I was at a naturopathic office and she goes, let's just check them. And I didn't even have any testosterone in my blood, like zero. And I think that was a guide, to help me take bioidentical hormones, because hormones are a big part of the immune system. So I think when you love yourself, you just naturally guide yourself to the right practitioners, the right book, the right podcasts, the right friends, the right food to help keep your body healthy. But to answer your question further, when you love yourself, you start to vibrate with the divine, because the divine unconditionally loves everything, including war, including crime, including politics, right? Like, the divine loves everything. So when you start to unconditionally love yourself, which is something humanity has not reached the tipping point yet. They have not. They've reached the tipping point of understanding that it's important. They understand that it's an important concept, but most people think it's still a thought, where self-love is an experience. It's an emotional experience. It's like when I love my dog who's in my office, or I love my children or my grandchildren, or I love a tree, or like, I've been to Greece 3 times, like, oh, like loving the oceans in Greece, on the shoreline. Like, so it's like having that emotional experience with yourself is the true definition of love. And when you do that, you get closer to your higher self, you get closer to God consciousness. And now you're connected to that amazing technology, if you will, or the AI of the divine, or of source energy. And then you have access to all kinds of understanding and knowledge.
Oh my gosh, that's amazing. So, for people who are watching who maybe don't have as much self-love, they know that there's a little bit of room to grow there. What can we do to cultivate that? Because I just think this is so important.
Well, you are correct. It's also helping us to advance our souls. I mean, other souls love themselves much higher than humans do, right? So I'm a fan of curious, positive, what if questions. In fact, I've made like 2 decks with questions on them. I'm like a fan. And so one of them, and I think it's probably in my stockpile in there, but what if I fell madly in love with me? So the brain, where the ego resides, I don't believe the ego is comfortable with affirming something that we don't believe in. I think it kicks it out of the brain. And so that's why people will use affirmations for years and years and years and not get a lot of tread within it. But if you use curious, positive, what if questions on any topic, the ego loves curiosity, positive or negative. It loves curiosity. And so when you ask these curious, positive questions, like, what if I fell madly in love with, what if I love myself as much as I love my dog? I ask myself that often because I just adore him. And then you start calibrating, the subatomic particles in your brain start calibrating to the solution of that question. And then once these particles are calibrated, they move through the blood-brain barrier and start to calibrate the rest of your energetic system, and you start attracting solutions. Maybe you look in the mirror one day and go, wow, you're kind of cute. Or you remember something about your past that you did and you love that you did that. All of a sudden you start to come up with reasons to love yourself. Like my dog, I have 800 reasons to love my dog. 800
Me
reasons.
too. Me too.
Right?
Me
Um,
too.
but it's a little bit more challenging, but it is the answer and the solution to our, expansion of consciousness. Yeah.
Oh my gosh, this is brilliant. I love that you didn't just answer my question, but you gave people a practical.
That's my job, so as a healer, which is what I am, overall, regardless of how I do it, is I really believe in giving people homework. I'm a big proponent of homework, and it can't be complicated. It can't be super challenging, maybe for some individuals, but for most, oh my gosh, who is that?
This is Blaze. I'll have to make a note to make us dual
Hi, Blaze.
screen.
And
She comes on my lives all the time. Her name is Blaze. She's a little German short-haired pointer, and she's my hiking partner.
she is. She told me right away that she's your hiking partner.
Did she
Yeah,
really?
right away.
Come
She goes, I'm the hiking
on.
partner. I'm the hiking partner. Yeah.
Oh
And she's
my
very
gosh.
strong and healthy and
Oh
can
my
go
gosh,
a
she is a
long ways.
powerhouse. You know, these dogs can live to be like 22
Oh,
years old.
well, I think if we, like my dog has he has his testicles, because I think hormones create longevity for
Oh
animals. There
my
was
gosh.
actually a major research done a few years back. A trainer sent it to me when Charles was almost 2, because he's a bigger dog. So now they don't remove, their body parts until they're almost 2 in large dogs. And so she said I was having a hard time with it. And so she sent me this podcast where they had interviewed these 2 veterinarians who now teach at university, and neither one of them had spayed or neutered any of their own animals. And this
Oh my gosh,
research,
I just had this. I'm not even kidding. I just had this thought last weekend. I was on a 10-mile hike and I was thinking about this like, should I do this? I don't know. There's something about it that makes me feel like I shouldn't, but I don't want her to have puppies. But at the same time, like, I cannot even believe you're talking about this. You're
well,
blowing
well,
my
this
mind.
is well, that means your spirit guides want us to have this conversation, and
I'm like
archangels,
ready to cry about
and
this.
your dog spirit guides want us to have this conversation. There are now some vets, because female dogs bleed, right? And so that's a problem or an issue potentially. Maybe it isn't for you. I've
Put a
never had.
diaper on them, no big
Yeah.
deal. Just
Okay,
like
that's
we wear
good.
a pad or something,
Right. So
right?
you could do a partial hysterectomy where you keep the ovaries and remove the uterus, and then she can't get pregnant. She won't have menses, but that is a surgery. So, that's something that you can hang out with. And they'll probably do vasectomies for male dogs. So the next dog I get, I may do a vasectomy. So yeah, there's all this research. They did it with breeders, because breeders have animals that are procreating and they have animals that aren't. And they showed the research that animals who have not been sterilized have less health issues, less cancers, less joint problems, less hip problems. It all makes sense. I mean, like if we removed the hormones from human children at a young age, we know that it would be, horrible for their health long term and even short term. So yeah, feeding good, healthy food, and then um, if you can, it does. Like I don't take Charles to dog parks because he will probably try to hump someone. But there are animals who don't have their reproductive organs, and they still try to hump other dogs.
Of course they do.
Right? So, and he sometimes growls at another dog. I mean, sometimes he doesn't. I don't know, and I'm sure it's his hormones. So there's that. You have to kind of figure out that part of it too. But I don't care. Like I'm happy he's got his testicles. Yeah.
Oh my gosh, I never know where these conversations are going to go. I
Right?
love
Yeah,
it. I love it
of
so much.
course.
All right, you brought something up in the very beginning and you've referenced it again during our interview, and I would love for you to speak it. And you said that our planet is not of the highest vibration
It's
in
not.
the universe. Will
Right.
you speak to what you know? Because I
Yeah.
hear a lot, I see a lot, I talk to people who are channelers and they're channeling other higher beings. Will
Sure.
you speak to this a little bit?
Sure. So, yeah, Earth is one of the lowest time space realities in all of the cosmos, but it was created to be that way. So, you and I, and many other people, everyone, we've been in non physical realms working on certain things like self love or vulnerability or letting go or stepping into our mastery. It's it's almost harder in non-physical realities. It's really not. It's easier, but you feel so good and you're having so much fun. And you don't need food. You don't have a job. You don't own a home. You don't need money. You're just like, oh, well, I'll come back and work on that later. And then finally we go, I really, really, really want to work on self-love, which is like the cornerstone of older soul types. Many of them reincarnate to the physical realm to learn to have self-compassion. And so we go, well, if I go to Earth and we sit with guides and archangels and our higher self, and we're present with everyone, source energy, and like I'm thinking of reincarnating to Earth, I'd really like to hammer down this self-love thing or whatever it is that we're working on. And so Earth is like a PhD program kind of reality. Also beautiful and gorgeous and stunning. I love nature probably as much as you do. I think it's stunning. I live where there's a wetland park just attached to my or wetland area attached to my property because I love it. There's two coyotes in the front yard the other day. Loved, made sure the cats were inside, but loved every moment of it, you know, right? So you can have those experiences in other dimensions, but not to the degree that we have it in a third dimensional space. So we come here to have the experiences, like you said, to have fun, sex, chocolate, coffee, Diet Coke, whatever, you know, smell flowers and to work on ourselves, you know, and we forget when your soul passes through, the majority of the population forgets what their previous lifetimes were as they move through the veil into the earth realm. But typically for most individuals, not everyone, they learn through their childhood experiences what they intended to work on in this physical reality. And so that's what they work on, whatever that happens to be. Some people, they learn if they had a great childhood, and everyone's, their childhood was perfect for what they needed, everyone's. They may learn it in a work environment, you know, they may have an awakening of something of that nature, or in a partnership, they may have an awakening of what they need, or a secondary awakening, like, oh, we're repeating everything again, you know? Yeah.
So, what has Spirit told you about how we choose? And do we come here voluntarily knowing that we're coming to this lower vibrational experience?
Yeah. Free will is the strongest law in the universe. That's why I'm not a fan of people say, oh, I'm in this fated relationship. I can't leave until this person gets healed because we have this karmic connection. And if I leave, you know, I don't believe in that. I believe that humans are like independent NBA players. You know, like we're not responsible for the growth of another individual, even if we've agreed, like, oh, okay, well, you help me, I'll help you. Like your dog said, oh, I'd love to come and be with Lori and hike all these amazing places. But if for some reason something happened, the dog would just go find another person to hike with, or if something happened to the dog, you would find another, you know, like souls have their own individual reasons why they reincarnate. It is a free will. We do choose our parental unit. So we don't choose the exact people, but we have a list of what would work for us and what would be in our best interest and who could provide the most help and how many siblings we would like to have. We even, children who are born with health issues, choose those health issues prior to reincarnation. Adults have more options for consciousness, but the reasons why children choose health issues are actually very profound and important for them and for their evolution, like type 1 diabetes, which is more commonly diagnosed in childhood, is because these children really want to learn a lot about their bodies. And you have to know a lot about your body when you have type 1 diabetes. You have to pay attention, you have to
Yeah.
rest well, you have to eat well, you know, you have to exercise, you know, and so maybe they haven't had a lot of lifetimes in the physical realm, or maybe they've had lifetimes where they didn't pay attention to their body and it's one of their major goals. Um,
So crazy you said that. My sister got type
ah,
1 diabetes when she was 12.
mhm.
And like, gosh, it's been a long time ago now. She had a kidney and pancreas transplant as a result.
That's
Yeah,
incredible and
it is
amazing
incredible.
because that's unusual. The pancreas transplant is very
Yeah,
unusual. Well,
so
congratulations
lucky.
to her.
So
And
right.
she wants to learn all this about her body,
Oh
right?
my gosh, she has had so many medical issues, but she is also an intuitive and has had
Oh,
near-death experiences. And guess what she does? She's
what?
the one who reaches out on my show to my guests because she uses her intuition to know who needs to come on. So we work
Huh?
together in
Oh, I
that
wonder if
capacity on
she's the
this
one who
show.
reached out to us. I didn't
She
know who it
probably
was. I was
is.
scrolling trying to figure it
Oh,
out.
it probably was my sister.
I'll ask my assistant. She'll know. Yeah,
So,
that's really
yes,
cool.
because I could see my sister saying, "You guys will love each other."
Yeah, right? Yeah,
Yes.
right. That's true. That's true.
Yes. Okay. So I want to share this because I had Blaze come on camera and you mentioned free will. I had an experience that happened a year ago where I was coming back out of my experience on my 5-MeO DMT. I talk about this on
Right.
my channel quite a lot. And as I was coming back, Blaze at the time was 9 weeks old and she
Oh,
had just started that needle teeth puppy biting stage. And she had scratched up my arms, my daughter's arms, and anybody who would get near her. And I had this thought because when you're coming out of this experience where you've been on the other side and you come back into your human body, but you're still in this medicine, you vibrate at such a high level. I find myself sending energy to everybody, sending healing energy. And I thought to myself, I'm so powerful right now. I could make Blaze stop that puppy
Sure,
biting.
sure.
But I immediately got this thing. It didn't happen like this, but this is how I'm going to describe it. It was like this. And the
Yeah.
universe said no. And this was what
Right.
was communicated to me telepathically. If you do that, you will negate the experience because free will is so important.
It is.
Without it, you negate the experience. So I
Right.
love that you said that about the free will.
It's so important, especially when it comes to, I mean, it's endlessly important. But when people cross over, and if, especially if someone thought, well, gosh, if I only checked on them, if only we took him to that doctor, if only we had not moved across the country, if only we fed them organic food or whatever people think, it doesn't matter. It's a special agreement, sacred agreement between a soul and source energy, the divine God, when a person wants to leave their physical body. And we have 5 exit routes. There's 5 potential times that a human, because of free will, there isn't just one. There's one that we pick, like, well, if I do this and I do that, maybe I'll leave at that time. But we don't know what we're going to do. Like, we have free will and everybody else does too. So we don't even know what other people are going to do. Like, we just don't know. But we have 5 potential exit routes, and that's near death experiences that some people have. Or I didn't have a near death experience, but when I was pregnant with my last child, I had a blood clot. And if I wasn't a nurse at that time, if I hadn't turned around and walked back into the doctor's office, who knows what could have happened. So we all have those moments where we had opportunities that we could have left the earth realm, but it's a very sacred experience and you cannot prevent the departure of a loved one. And it's nobody's fault or anybody's responsibility. It's only the soul's free will that they're ready based on experiences they've had in this lifetime, and they have their own little checklist. Oh, I learned that. Oh, I learned, ready to go,
Marie, I am so glad that you brought this up for multiple reasons. First of all, we talk a lot about on this show that nobody dies before their time. But when you say things the way that you do, you release people because I think when we've lost somebody, we start to reflect with hindsight of those things you said. I should have taken this doctor. I should have gotten this organic food. I should have done X, Y, Z. It doesn't matter what it is. And then they beat themselves up and they
Yes.
blame themselves and they put themselves in their own prison as a
Yes.
result of thoughts that they just cannot get out of their mind. And
Right.
once people have a different perception and they know it wasn't under their control, they can
Never.
release themselves.
Yeah. And I think one of the things we need to learn to do on earth, which was a big part of this conscious growth, is we need to honor the decisions that souls make. However they, for however long they want to stay here, whenever they want to leave, we can still grieve and have, of course, and have whatever experiences we need, but we need to honor the decisions about souls, because it's an honor to be here. It's an honor to transmute your energy and to go into a different reality. This is one of the few, if not only, realities where you move into a body and your body has to die for you to leave. As we grow consciously, eventually we'll be like Tibetan monks and we'll just reduce our blood pressure and our pulse, but we'll tell everybody, and we're gonna, oh, I'm gonna cross over next week. Okay. I'm sure it will be more, the conversation will be more involved than that, but
They're like, no, you cannot go.
yeah. But I think we'll have more conscious decisions about it. My daughter had a friend, she was in college at the time, and he was diagnosed with a brain tumor. And thankfully, it was removed. Everything was fine. He died 6 weeks later in a drowning accident. So
There's an exit point, and he took another one because you can't
right,
prevent something
you can't.
sometimes.
And so that gave me a great opportunity to really hone that in with my
Wow.
children. That because for some reason my children have been to a lot of funerals when they were quite young, and I think that they wanted to know more about death and dying and understanding the authentic truths of it versus the human limited perception of it, which I think holds humans in prisons and holds themselves back. Not that we shouldn't grieve. I think that's an important process. I think grief is very powerful, but we also need to enjoy what time we have here too.
Absolutely. Okay, so you've spoken to spirit for so long. Will you explain to people what you understand about dying?
Oh, I just think it's a normal experience moving from this lifetime to another dimension. That everything on Earth, this is a temporary reality. First of all, even glaciers don't want to stay here forever. So I always get alarmed when all the environmentals are just freaking out. Not that I don't think humans don't need to change. We do. We over purchase. We put too many things in landfills. Yes, we absolutely need to clean up our act. Absolutely, and hopefully, like I live in a state that recycles everything. Like my garbage can is so small, but the recycling bin is like 10 times bigger, right? So eventually we're moving in that direction. But even glaciers, because they're alive with energy, they are beings as well. And rocks are mountains. You know this because you've been in
Everything.
nature.
The
Everything.
source is in everything. You can't
Right.
take source out of anything.
Right. So I don't believe death is actually a true word or a true definition of what happens. I think that a soul comes here, has an experience, understands what they're moving into, has full awareness of what's going to happen in terms of transition and moving in a womb and being born or however it may happen in the future. And souls are excited for the transformation and to go back to their friends and family in their real home. That's our real home outside of the earth realm. So I don't think of it, I think of death as a really precious, phenomenal, out of this world experience
And are
for
you afraid of it?
not now. I don't know how I'll feel when whatever age, for whatever reason, I decide to leave earth. But no, I mean, I think that's why I love to be at the bedside of people who are crossing over. I was very fortunate. One of my friends who was an astrologer, he had never seen me professionally, but his family had. And one day his wife called me and she goes, "There's something wrong with Jeff. Can we come over today?" I go, "Sure." He came over. I knew immediately he was dying. And he had an MRI, but they had got the results. And sure enough, he could have probably prolonged it, but it was an inoperable tumor in his spine. And I've always attracted a lot of cancer people because of my hospital work, right? And he wanted to just go. He was very aware, very conscious. His family was too as well. So he went to hospice, and they thankfully invited me to be in the room with him and their family on several occasions. I never asked, because it's I think such a profound and moment, especially for family members. And after a while, he was unconscious because they medicated him well. That's hospice is so great. They make sure that people are as pain free as much as possible, which is phenomenal. They're great at their work. But I could translate because I could still have communication with him, mental telepathically. And so I would talk to the family and tell him that he was laughing at their jokes or whatever. It was a really amazing, profound experience. And I think that's what death is supposed to be like. I think we should all be conscious in the decision making about it and the understanding and the celebration of it. We have to change our whole paradigm about it and not make it this thing that's never going to happen, because it happens every single day to everyone in every family. And I think that would help our awareness if we could find a way to embrace it and to celebrate it and to love it and love everyone. I think when you start to look at death that way, you just love all the people in your life in the present as much as possible. You
Yeah.
know, you just do, because you just know anyone could go at any time, which is true. Anyone could leave Earth at any time. And those people who have lost someone, they know that because they've experienced it. I haven't really lost anyone super close to me that I had a strong relationship with. And, but I just, the people who I do know that have crossed, I still get to see them and I still get to hang out with them. And I think as we evolve, and if we get past this false perception of death and look at it for what it really is, then I think every day, people will be able to have the experiences that I get to have. And I wish that for all of the human realm and always have.
And of course, having conversations deeply, really, really,
Deep.
we've had deep conversations about this the whole time. And I know she came back.
She's so
Um,
cute.
thank you. you. They certainly help everybody to get a new perspective, maybe have a new appreciation, because who knew you could have an appreciation for the death process? Doesn't mean you're not going to miss the
Sure,
people. You're
of
going to miss
course.
them for sure because you long to be with the people that we love. But when you know that they're actually happier or in
Yeah.
a different state of happiness, and also, like through the life review, I love the fact that people have a life review because that means when your passed away loved ones leave this earth, they get to experience every moment they ever had again with
Yes.
you from
Yes.
not only their perspective, but from your perspective. So
From
when our,
source perspective,
right,
which is the whole
right,
enchilada, right?
yeah,
And in fact, when I see people leaving their bodies, I see this rocket shooting up in most cases. And they're starting to gain consciousness like a Jungian psychologist rapidly before they even get to the other side. And those are the people who shoot out very quickly. Some people may take longer, but they start to get, oh, Uncle Bob really meant this, or oh, my mom never meant to say that to, like they just have this huge elevation of consciousness rapidly. That's why sometimes people don't recognize their loved ones, even when they're visiting them, because they kind of hold them in an old perception of who they were when they were on earth. And they will share something that is profound for you that you would be able to recognize them, like a smell or a memory, or maybe you'll see their eyes, or feel like they're holding your hand, but they're not the same person because they're connected to their higher self.
you've developed a few techniques that people can work with you. And I would imagine by now people are chomping at the bit to know how they can work with you, what you do. So will you tell everybody how they can find you and how they can work
Sure.
with you?
Sure. So my website is energyintuitive.com or mariemanuchehri.com, either way. I do a biweekly podcast where it's live and people can ask me any question they want within a short period of time, and I answer it live. So that's kind of fun. I have kind of stopped doing one-on-one sessions. I've slowed it down significantly because I love to teach now, and I like to teach a percentage of people versus one-on-one. So I like to help a bunch of people at one time. So I teach a lot on my own platform. I teach on the Shift Network and the Humanities Network and other platforms as well. I do power sessions, which are recordings. So you can, I only release a certain amount, like maybe once a month or every couple of months, and they do sell out within a minute. So they sell out very quickly. But someone would leave like an 8-minute recording, a voice recording, and then I would return it with a 20 to 25-minute recording of answering
Oh,
their question.
brilliant.
Yeah, it gives me more freedom, so I can be anywhere. I can do it at any time. I don't have to have makeup on or fix my hair or anything
Yeah, you
like
know, to be
that.
camera ready.
I don't have to be camera ready. Yeah, so I started that
It is
last
a thing,
year.
you guys.
It is. It's a thing. And I did one-on-one for nearly 30 years. I still do a few, but I just don't do them as much as I used to because my body just wants to affect it more people at one time. So taking a class, I teach on every topic from mediumship to energy work, self-love. I teach Reiki still, which I love. I teach that in person though, in Seattle, and I have a class coming up in September. And then I do usually an international workshop once a year. I'm teaching one
You're
in
going to
Canada.
Greece.
I not this year. I decided to stay close to home because everything's just a little weird. So I'm teaching in Victoria, Canada this year, a 7-day on discovering your magnificence.
When is that?
Oh, so when is it? It's in July, the end of July. I think it's the 24th through whatever 7 days that is.
And
And
we're
we're
recording in 2026 in June.
June. Yeah, so
Yes.
next month.
Yep.
And we're going to do whale watching and go to the gardens. We'll have 3
Is it
meals
already sold
together.
out or do you still
It
have
is
spaces
not. I
open?
still have space available.
Okay.
Yeah.
Okay.
Yeah, it's really, really, really fun. So I've taught in Greece 3 times. I've taught in Spain. I've
I knew
taught in
you did. I was kind of teasing
Ireland.
you, but I'm not surprised you went
I've
there.
taught in Ireland and Hawaii. So yeah.
Wow.
I do my own
I
stuff.
love this. This is great. Oh, I'm curious for the people who are watching, what about Marie's discussions today touched you the most? Was it how she felt about death? Was it about the self-love? Was it about the signs and the synchronicities and the healing with listening to patients' organs? Like, I'm curious. And even if you don't want to answer, you just want to write collective, waking up the collective, that really helps. So this has been such a fun conversation. So I'm going to actually ask you two more questions
Okay.
because I do lives also. And
Mm,
somebody asked me this question in my live on Wednesday, and
mm.
that is, how do you personally feel about yourself dying?
I'm looking forward to it,
I said the same
honestly.
thing. I mean, I'm not looking for a death wish right now. I gotta live out my life in
Yeah,
peace, but
yeah,
still.
yeah. I mean, I've been on the planet for a little while, and my children are grown. So, it would be different if I had young children and
Yes.
all of those things. But I'm looking forward to it. I feel as I love getting older because my life just looks better and more interesting and more fun.
I
And
love to
so,
hear you say that. That makes me so happy.
yeah, well, it's the same is true for you. You like getting older. We may not always like some of the things we see in the mirror or
Yeah.
how things start to
I
change, but
love
who
the wisdom.
cares?
I love the perspective and how that's changed and the perceptions that are different and how as you're on the spiritual journey, I feel like you become a new person every few months because of all the information you're accumulating.
I think it's really true. You're transforming, your light is shifting, right? Which
Yeah.
changes your physical. And people live a long time these days too, and
Yeah.
healthy long.
Yeah.
It's not like our grandparents. Um, so yeah, I'm looking forward to it.
Okay, so here's the question that I try to ask all of my guests, which is, Marie, what do you know for sure?
Wow. About anything?
Whatever you want to, however you want to answer it.
Well, I will say that I did not think what I'm about to say would happen in my lifetime. I did not think that would happen, but I do think that humanity is waking up. I do think that consciousness is on the rise. I think we're very blessed and lucky to be here on Earth right now during this transformational time. So I know for sure that more and more people will be like me or even better than me. And I'm so excited for them. And I wish everyone, the awakening that will give them the peace and the understanding and the joy and the fun and the health and, just all the good things. I do also know that vibration is truly the answer to everything, that where you vibrate your energy affects your life and affects your knowingness and your consciousness. And so finding authentic things that make you really happy and repeating them. It's like rinse and repeat, or finding new things that bring you happiness raises your vibration. And people who will live on the other side, they live in a very high frequency, higher than anything that Earth experiences. And they'll drop their energy a little bit, but they cannot drop it to our level. So if you want to connect with your loved ones or heal your body, or change your life in any way, you do need to raise your frequency and your vibration, because everything that we want exists in high frequency. All the things we don't want exist in low vibration.
I second that. I think we're going to start a new thing. We're going to start walking around going, Happy Awakening, Happy Awakening.
Okay.
Oh my gosh. Marie, I can't tell you how much I have loved this
Me too,
conversation.
Lori. It was a pleasure to meet you. You are lovely,
Thank you.
lovely. Thank
You
you for what
too.
you do in the world and
Oh,
all the
no.
awareness you
I have
bring.
to say to you, thank you so much for what you are doing to wake up the consciousness. It is so needed right now.
I think it is a joy. It brings me great joy. Yeah.
And of course, this show is absolutely nothing without all of you who tune in to watch, to listen, and to share these beautiful experiences with somebody who needs it. And if you still have questions, you can join me for Wake Up Wednesdays live at 5 p.m. Pacific, 6 p.m. Mountain, 7 p.m. Central, 8 p.m. Eastern. And I'm going to let you say your live. When is your live?
Fridays at 10 a.m. Pacific time.
Okay.
Every
So
other
you got
Friday.
questions.
Every other Friday.
You've got places
Yeah.
you can go to
Yes,
get your answers, and we
exactly.
love to do it. We're doing it for free because this is
Yes.
our calling,
Yeah,
right?
because it's fun. I
It's
enjoy
fun.
it. It's fun. It raises my frequency, and
Me
it's
too.
worth
I feel like
every
I'm
moment.
vibrating and buzzing when I get off of one of my lives.
Right? Yeah. Yeah.
Seriously. And of course, so thank you
Thank you.
everybody for
You're welcome.
watching.
Do you believe that love never dies and you want to hear stories that prove it? Well, hit the subscribe button. You belong here.